Hello, welcome to Bombay Fiji Bazaar. We are here to help. Largest collection of Indonesian and Polynesian and Micronesian community. So you're welcome in anytime. We are open 7 days a week from 10 o'clock till 7 o'clock, and Sunday is 10 to 4. So all of you guys are welcome. Indian, Pakistanis, Polynesian, Micronesian. We have all the community stuff right under one roof. Thank you.
paini tu kapakamatala Holani keloa matai ngata Lono atawa ke pai hana Veta talo moi o tu hei lala He wisai Kapakapo Amasi mono kuloto Kaneo Eneto Na maunga ki e kai pono Na e tuko e ponua E tupo o hapai ki o lunga Ke malui Me o lunga A tonga nio whai o tupua
Welcome to Voice of South Pacific and Radio Tonga broadcast from Seattle, Washington, international and local. Mala waila mali aho eiki pe aleleia tongotoa tauto e tuuta mo I mai ke ahua valua sanuali o I wafi wataha. Koe tawa o mai ke to prelulu faos ko ia o I mahina o waki o tau. Pe o tau whawheta I ko tau lava toi whelongo aki e ngalo ea pe mo E wahau pe me whetu ko tau pe mo mea mai kiai. Ko e programa le toe ni ale o Pacific South whahau ka tia pe me Seattle, Washington. Pea ko ia ko tau programa ma ke he ahoni. Pe tau kau whataha I pa mo e taha kau tokon whaiwhekau me Seattle tonga hau eki. Aia ko wā ke tapa tau tai. Tēnei tataki ki tau tolu. Pea te tau tokahoko atu ki whakaikiki o ngai polokalama. Hange ko ia ko polokalama ai King County. Pea mo whelala ve I pea mo community. Ko au sirivia taimi aho pe pehe whoki kia neta tua tā pea lava o kuma whakahoko atu ai polokalama ko ia o E ahoni. Pea te ukole angeni ke o atu ai laki hiva ko ia e sasa tonga hau eki pea e tataki ki tau tolu a ki halotu e whaiwhekau wā ke tapa atou tai. Ko langa lewa ke tangata e ki whaiwhekau whakakolo koe ni ke nei tataki ki tau taulo a ki halotu I he hauwani. Wā ke?
Ke ki au pita ke maasanga maare koe ni, ke paha tau otu. Tau otu e otu a maa ane atla. Aho awhio o kuke awhio I he tau katapa whau. O kuhu maa ane oni o maa ane oni e awhiona. E ko fofonga o buiroa a fofonga ko sino wa siai la o kuke ofa ki he mea hono kotoa. E kuke mave ki he whai mesi, a ki kuai ki he hou whau. O tua koe o utaha pe maoni pia mo utoki. E karu me mua na iae a siona, I lo tongani o kuke iai. I whai ki e pia o uke panga o tani. Umau kwa pita ilahi e just pakuani. Mau kau kuataha tamo e Radio Voice of South Pacific I he Jasini. I he whai ako e lotu pe me huki o ofia. Pero hi pe me Seattle, Washington, e mau konga ia I he taimi, pe me whainga maari e kuki o mau tola e mau kui. E mau whai sa patongia pe mau ngā olere, koe e ko whai I he konga kau nangani. Mau nau tolo, nau kuarere e proklama radio koe ni mau kau kuataha. I he Jasini. Mau kwa maro atu. O Joaquin Fortress. A sirvia taita. A maane tatua. La tu waka mo tanga si kau ngawe hono kotoa. E ka petina kina tou fai manawa kawa e ngawe. Ya mau tui. Ngawe ni. Ko ngawe ko lau mari e ia no ko e maha o tangata pe mo tangata. Pagi mo family. pureanga te mo funua mo funua. O mawanga te klau mari. Ito wakau ngani, ngani fae kita o ngani family. Te mo fai oskia verenga nga wen yo mawanga tu. Pakiwi, wakata pakalani, ini pa otua. Mo uile kres o te nga de pa yati na upatumia. Kwata hamak mautoluni mau pawata. Te mau keinga te piloa. Ako mauli o ne ko tala noa ngoa ko ingoa ake o ka reti o ko en. Ako mauli o i Pacific Tongan. Whaka ngongo le reiti lan ka apion. Ako mawanga tula o maari e ka papuani. O pamana te mau teiteo e mau pokalama te hokuan. Ako mau kamaka atu mau patongia te tonu. Kai ko ia te ko mau patongia te tonu. Ako ia mau kalingi kwa hoko i lopu kia te tonu. Wata hape msita unga awa i kono kotoa. Tomasio maunga i wātu i kotoa. E ngā awe mau pa i te hua. Te meri no te mo mau pe o kopa nuki ale pāsa ngā awe o plele. Te koi a piha o pola nā te tālaki. Nau ka wako. Yo ngā awe o plele i te whaia. Pai i te o kopani te moi perina te moi pes. Mawanga tu au nāri. E te tine e mona kono koloa e pokama. Oka kono ko teu e si ngāsa e taimi. Pero mau koe a kai, kau ka amu o te programani. Dori te kai kama tatamia, community, ka me moule si kakai katabe. Au malone, ko maulave ai. Au maupoka ia. E na ulava o kai ai mahamu le rei kai. Tāle ki o maunga e family na si o kotai ingo. Angai kama e kupe mau keo mo pau mau e taka. Wa o ke ngata panga o tutu o na mau maui. I te o kupante mo mehi no. Magkasta action. At abuti natin na ito pa mo po kama kung ano magkakaroon ko sa mga family. So, mamalu. Ay, isip na umahin mo uwi. Ang ay ko kung mamayin, igual ka mo po ito, mga italinig ko. So, maupanaw ko mo pa rin mo ko. Bigyan ko ulit ang ginagawa at yun. At ay ko, presyo mo kayo mo. Nakapupulat, kumagawa ang at yun. Ang ay mga mainan, kasi ako may ay lot ba yung may langin. Kaya lot tayo mga huwag ko ay kung magkaw. Kung ko rin yung huwag pa alo ko si Jesus Christ, ako yung pagkamaw mo uwi. Amen.
Amen. Pamalo lahi heni ko e lava lele ai loko tāpu ki nau e tau polokalama e ahoni pea ko e whaiwhekau ia pea me siasi o Tonga ka ko e takoni whaiwhekau whakakolo ko whaiwhekau wake tapa a tō tai ko e loto hona ia mooni Okay, e loto honga ia mo oni I he kau whataha pia mo e siasa o Tonga, pia mo e kau hiwa e nau kau talavo. Pia mo whamanatu mai ko e taimi pe eni. Pia ko ia ko e tau konga ulaki e tau kulkama, ko e lava atu ai lotu kamata. Pia ko i te mahoka tu heni pia mo e kau ngawe ko ia ai King County. O ko ia e mau whapota anoa ko e polkalama e ahoni ko e Community Outreach Program. And also we have the King County staff to talk about different process and what are important for our people, Pacific Islanders, to know about the COVID-19, like the vaccine and other resourceful information that will help your church, your families, and the community during this difficult time. Malo, te kolengen ka sela kene ki I tae peki mini te taha, while we're getting ready to go on with the King County staff. So we'd like to welcome all of them. Neta, can you say hello?
Hello, everyone. My name is Netatua. I'm I'm a cultural navigator for the PI Health Board for the Tongan community. So I'm happy to be here today and discuss some updates for my community on COVID.
Yeah, and also I'm Sylvia Aho, and we'll just give you like a little Pacific Islanders melody, like to kind of warm us up just for 30 seconds, and then we'll continue to start. Sela? Okay. Well, that's a song that said, it's like the breezing that coming from the South Seas, It's kind of giving you, like the little melodious song and the sounds from the South Seas Islands. Welcome. I think we have Vanessa and Swamhurst, and I think that I have the other one. I may be missing out the name, but I'll make sure that we catch up with everyone. So welcome to the Voice of South Pacific Islands broadcast, and we are so glad to finally have all of you to join us today, that we could be able to have the resourceful information through our Pacific Islanders community of what's happening right now. So my first question, before we continue on, I would like to welcome, Vanessa? Yes. Okay, and Swamhurst? Okay, and the last one, can you say your name?
Christina.
Oh, Christina, okay.
Yes.
Okay, I have my first question here, and I have Netatua will be joining us. And I think I have another person that may be joining us later. But in the meantime, we want to take this opportunity to ask you a question that will be very helpful to share with our Pacific Islanders. Vanessa, what trends are we seeing right now with the COVID-19 and the number of cases in King County, including with Native Hawaiians and Pacific Islanders specifically? I hope you can hear me.
I do hear you. So
okay.
Thank you for having me here.
Yes.
My name is Vanessa Quince, and I am a social research scientist for Seattle, Public Health Seattle, and King County. And I will break your question down into two. So what are the trends that we're seeing? So first of all, I want to say kudos to everyone for following social distancing guidelines, wearing your mask, and keeping yourselves and others in your community safe. After seeing a peak of cases in early January, we're starting to see case counts. So the number of people in King County who are testing positive, we're seeing a steady decrease. So there was a peak on January 6th, and since then we have been on a steady decline. This is both in terms of positivity, so how many people have been tested positive of COVID-19, but also hospitalization rates. So the number of people who are going to hospitals, that has decreased, and the number of deaths associated with COVID-19 has decreased as well. So in general, we have like better than bad news in terms of like how COVID-19 looks like throughout the King County community at large. When we take a closer look for Native Hawaiian Pacific Islanders, so despite the decrease that we're seeing in COVID-19 cases, we're continuing to see certain communities be disproportionately impacted by COVID-19. And unfortunately, the Native Hawaiian Pacific Islander community is one of those communities that are continuing to see higher rates and higher cases of COVID-19 transmission throughout our community. So just to give you just like a comparison point, so right now we have current rates for Native Hawaiian Pacific Islander, current positivity rates are 8,000 per 100,000 residents. And if we compare that to the lowest group, the group that has like the lowest incidence rates, that would be white people in King County. Their rates are about 1,600 per 100,000 cases. So you can see there's still larger, it's a disproportionate impact in our Native Hawaiian Pacific Islander community. So we are currently in phase 1 of our vaccine dissemination. So phase 1 has been broken down into like several different tiers. So we are currently in phase 1, tier 1A, as well as tier 1B. So tier 1A, that was when vaccination first started. So this includes healthcare workers. So this includes people, so high risk healthcare workers in healthcare settings, high-risk first responders, long-term care facility residents, and all other workers in healthcare settings. If we think of who those frontline workers were, who people who was working in hospitals, who was working in those nursing homes, phase 1A is to make sure that our frontline workers are getting vaccinated so they can continue to do the work in their community. Recently, we've opened up to phase 1B. So phase 1B, this has opened up to all people who are 65 years or older, as well as all people who are 50 years or older in multi-generational households. So by multi-generational households, what we mean is that like 2 or more generations are living in the same house. So if we think of like, if there's a household with grandma, mother, and child, that would constitute a multi-generational house. And anyone who is 50 and older in that house is eligible for a COVID-19 test, for vaccination, sorry.
Thank you so much, Vanessa, for those essential information, and we're so glad to hear that. And I'm gonna ask, this is my co-host that is also working with the Pacific Islanders Health Board, Neta Tua. Neta, do you have a question at this time, to ask to Vanessa or any of them?
Actually, before we move forward, if all 3 of you, I know Vanessa did talk a little bit about her role, but if all 3 of you can first introduce yourself and your roles and what you do in the community, just so that way everyone knows who everyone is. Yeah.
Definitely. So I can continue. Sorry about that. I went full fury. So once again, my name is Vanessa Quince. I'm a social research scientist at Public Health Seattle King County. So I am the primary evaluator for King County's Zero Youth Detention Initiative. So I take measurements and collect measurements for the program that is Zero Youth Detention, which's goal is to get the amount of youth detained down to 0.
Okay.
Nice.
I also do I do capacity building workshops for community-based organizations. So that is mainly like data and evaluation. So monthly we do workshops with our community partners to help build data and evaluation capacity.
Perfect. Thank you.
Perfect. Thank you so much, Vanessa. Neta?
Yeah. Christina, do you want to go next and introduce yourself?
Yes, my name's Christina Braddock, and I'm a public information officer for King County and Seattle Public Health. I work to make sure we're getting information about COVID out to communities where it's most needed. And I help to translate the science of things and what's going on so that people can understand it. And that we're making sure people have accurate information in their community about COVID-19 and the vaccine.
Okay. Thank you. And last but definitely not least.
Hi, my name is Swamir Supraina Guzman. I'm a licensed behavioral psychologist. I work with what's called the Behavioral Health and Recovery Division at the Department of Community and Human Services. My job is primarily to work with the community to create behavioral health services. They are culturally driven, they are community driven, and they meet the cultural and linguistic needs of our communities, especially right now during the COVID-19 time. Additionally, I support the COVID-19 effort through the community and community well-being group, where we provide a lot of education and trainings or this type of conversations on behavioral health and the challenges that COVID-19 has brought us on our emotional and psychological well-being.
Well, that's awesome. Thank you guys for being here to answer our questions. I guess we'll move on to the next question.
Yeah, the next question is, this is for Swamphurst. What are some coping mechanisms people can use, and are there any King County resources that is available? So what are some coping mechanisms that people can use, and are there any King County resources that are available?
Yeah, if we can first kind of set the stage of like to talk about the challenges that COVID-19 has brought us, not only in the medical field, we know that people are being impacted medically by COVID-19, yet we also are finding out that our emotional and psychological well-being is being impacted by COVID-19. As a matter of fact, there's 1.5 to 1.7 million people in Washington state right now experiencing moderate to severe anxiety, and almost 2 million people across the state who are experiencing moderate to severe depression, and that is all associated to COVID-19. So it really brings us to like, why is this happening? And the reality is that for people for people who come from cultures who are communal cultures who embrace family, and it's a challenge for us from a cultural perspective, right? We would like to hug people, we like to thank them, we like to give them a kiss in the cheek, and right now, for our own safety and their safety, we have to maintain the social distance. However, this lack of cultural interactions often impacts our emotional and psychological well-being. And some of the things that we can all do to really to perhaps cope with the challenges that we're experiencing right now is by first acknowledging that what's happening right now is circumstantial. It's not us. This is not, it will not determine our future. It will not determine how we're going to live our lives in a couple of years, perhaps. So the reality is that, right? Think about starting in the moment to acknowledge that this is circumstantial and it will not be our future. The second thing will be to like really take care of your person, take care of who you are as an individual, acknowledge yourself, acknowledge what really challenged you, right? Like really taking that moment and think about what about this situation is challenging me, and really acknowledging that challenge and find ways to cope with it or manage. The second thing is to really acknowledge where you are, where's your place within your community, within your people, and how can you be of support to others during this time. A support, of course, in a socially distanced way, in a protective way, but that's who we are as our communities, right? We like to engage with people and support them as much as we can. There's a place for us to do that. We just need to do it differently. We need to either talk to people on the phone. We need to perhaps do video calls, or engage and use what's available to us to really to continue to work with our communities, and also acknowledge the time, acknowledge what's happening with us right now, and know that what you may be feeling, what you may be experiencing, the challenges you're going through right now, again, our situation or to the times that we're happening right now. And the last thing again goes back to really for us to acknowledge who we are and how we're being challenged by COVID-19. For me, it's always challenging. I have my firstborn kid, and my parents didn't. My parents are we have their firstborn kid, and they have never seen my son in person, and that is a challenging thing that we really, to me, they are special to us. So it's really for us to acknowledge that and to really work through and reframing, right? I know that I'm keeping my parents safe. I am, I'm keeping my parents safe by, doing video calls instead of being in person, right? So think about that. Don't think about, I'm not seeing my friends. I'm like getting all rattled up about it. But the reality is that you're keeping your friends safe and your family safe by staying at home and doing video calls and talking to them over the phone and staying engaged in that matter. So there's a lot of things we can do. But first, we have to acknowledge again, this is situational. This is not who we are.
Thank you so much, Swampurst. This is another question here, like for both of you. What is the most important things for people to know right now? You just mentioned a lot of the information, but just like the testing, the masking, and what are your thoughts about the future to allow us, going back to school, work, and church after this pandemic? What is the most important things for people to know right now?
I think I'm going to jump in here.
Okay,
I think
Christina.
it's important. I think it's important for people to know that what they're doing is working. As Vanessa said, the numbers are going down. There's been a lot of lives lost and a lot of pain. And if people weren't putting in the efforts they are, that pain would be a lot greater and there would be a lot more people lost. And when we think about going back to things such as church and school, those are such safe places and places that give such mental health relief. And we want those places when we return to be places of celebration, not places of mourning because maybe we're missing people or they're not there. So I think the most important information is to continue doing what you're doing because it's working. And if it feels like maybe you don't know people who have COVID or maybe you don't see it a lot in your community, that's likely because it's because masks work and it's because social distancing works. So recently, a variant of COVID-19 was reported in Washington state, and we knew for a while that it would be on its way here. It's been seen in other states. And what we know about this variant is it's very similar to the COVID that we know, except it's more contagious. So it can pass easier. And that just makes all of the precautions extra important for people to continue to do them.
Thank you so much, Christina. Netta, I'll give you this opportunity if you have anything to ask at this time.
Yeah. I guess I want to ask is you're talking about states and people going in and out of states. Travel updates. Do you have to test negative to enter Washington now from out of the state or out of the country? A lot of our communities travel within states to see the families and whatnot. So yeah, do we have to test negative to enter Washington now?
A lot of the travel precautions are precautions and strong recommendations. And what's put in place are things, for example, if I go to California right now and I try to book a hotel, they ask for my driver's license when I go in and I'm out of state. The rule is that the hotel may not rent me a room for one night, that they have to have a 14-day stay to ensure a quarantine when I go into California. So there's precautions such as that in place. But especially if you're traveling and staying with family, those are recommendations. There's not a hard mandate. What we do see is when there is flight, if you were to fly into Washington right now for another country, they would want to see a COVID test that shows that you've tested negative or a quarantine period. And that's different though for every state.
Right. Okay.
Thank you so much. Also, ko ngai whamatala kone nguna tuku mai o kulawa pe ke wholau ka ukto iai pe whakita ngai tu uni hange ka pau ko e quarantine foi a ta wha pea o ko lava pe ka nge ko ngai huhu kone tuku mai ka ako fuwhia mau au pito ai huhu ia ki kau matu o tua hange ko e kinau tolu ko i una ngau he ngai whare mahaki pe ko ngau e ko he ngai public place o kulawa le ke mau ai huhu ka kinau tolu pe ko hakakai una fo o tauhi hakakai ko e kakai o fuwhia mau lai taha ko i he tunga ko e taimini. I think that I'm going to get back to, there's something that we always ask you, over and over again, what is, like you're looking at this, that we're traveling at this, during this pandemic, what do you think that, that like tomorrow that we have the vaccine, do you think that everything is going to be controlled by the vaccine? I'm sorry to change my question, but I have seen, like Dr. Fauci saying, that taking a vaccine, that doesn't mean that you cannot wear your mask, You have to still keep the social distancing and wear your mask even though you have the vaccine. Or any other information that you wanted to give out,
So you kind of summarized it yourself, right? So
Yes.
it's very much, these are all a part of like a continuum of things. You must, if you get vaccinated, continue to be masked, continue to do social distancing, continue to try to avoid engaging and being indoors with others. This is just a gamut of things that are kind of like in your arsenal to help defeat COVID-19 throughout our communities.
And I think one thing to realize is when people talk about the COVID vaccine, a lot of times they talk about how fast it was developed and how quickly they're getting it out to people. And there's many reasons for that. All of the safety precautions are taken, but they also found out the information that they need to make sure it's safe and to make sure it's effective at stopping the vaccine. In normal vaccine trials or development, they would have continued to do the research on how contagious is somebody if they get the vaccine, or how long is this vaccine effective? And those research questions are still being answered. So what has been answered is that it will reduce your chance of contracting COVID by 95% after 2 doses. But the reason for the masks is because we don't definitively know those other answers yet. And that data is continuing to be collected.
Thank you so much.
Yeah, while we're on vaccination, what vaccine locations do you have for King County, for any of our counties? And are they available to be registered for doses right now, or is it limited?
Sorry, I can answer that. You're asking about doses in King County?
Or just like any vaccine clinics open for like our community right now, or whoever qualifies for the certain phase.
Yes. So I don't know if your listeners know yet about form.findyourphasewa.org. And you can also find a link to that website at kingcounty.gov/COVID. And this takes you to a tool called Phase Finder. And this is where you can answer questions to see if you're eligible. If you're not eligible, you can enter your email or your phone number to receive a notification when you are. And to get to what you were asking, at the end, if you are eligible, it matches you with a vaccination center. We know that in early February, vaccination clinics will be opening in King County, and these will be large volume sites. I encourage you to visit kingcounty.org/COVID to know when those are open in early February. And those will be not only able to serve a lot of people, but also if people are not connected to a physician or a regular healthcare system, if people don't have insurance, or if people are undocumented, those are all people that can go to the site and receive a vaccine.
Awesome.
Awesome. Okay, I think you answered my last question I was going to ask. So, if the people are undocumented and they don't have any health insurance or any other condition that they're dealing with, any other situation, everybody can go visit the www.kingcounty.gov, right?
Yes.
Iyo. Ai ko ngai information e lava ke mo alhanga tonu ke website I te mauto tuku iatu. Sela, if you can put it out, you know, on the page. Yeah. King County, www.kingcounty.gov, ko ngā ke lava o tokoni. Ka ki moto ko yak mo manamasi be mo rifia, mo ngo I puke, ka mo fie mao ke mo huhu, take the vaccine, be ko mo fie mao ke ngau aka ngai whaito, be ku iai peha mea o mo fie mao e lava ke tokoni atu. Ko ina mau tuku iatu ia I he taimini. I he ata pea mo e katoa pea mo YouTube e lava peke mo mao e whakaiki ke o information ko ni. Ko inga ko information ko ni o how hanga tonu me tau local government me he tau county me King County. Okay, Neta?
Yeah, so still on vaccines, for anyone taking it coming up here, do you have any tips for anyone, or like what are the common side effects so far for people who have taken the vaccine?
So common side effects, what we see is you may have heard them before if you've taken other vaccines such as a shingles vaccine or a measles vaccine, and they include pain at the site of injection, possible fatigue, headache, or a slight temperature. And these are all signs that your body is building its defenses to the virus. And those are the main side effects. They tend to be greater with the second dose. People report more, but overall side effects have been very low.
Okay. And speaking of, so there are 2 doses to both vaccines, Pfizer and Moderna, correct? Mm-hmm. And how long in between each dose do you wait?
For the Pfizer vaccine, you wait 3 weeks. And for the Moderna vaccine, you wait 4 weeks.
Okay.
If your provider cannot get you in, or maybe because of your work or family schedule, you're not able to get in, and it ends up that it's 5 weeks or 4.5 weeks, that's not a big deal. And you should still get your second dose, and it will help with your immunity.
Okay. So get the second dose even if you go over the time.
Yeah.
Okay. Yeah. Yeah. Oh yeah. Is the vaccine safe right now for any women who are pregnant or breastfeeding?
Thank you for saying that. That was my other question. Because my daughter just had a baby and she was just kept asking, you know, I wonder if it's safe for me to take the vaccine, you know, because I'm breastfeeding my baby.
Mm-hmm.
Yeah. So the vaccine was not tested specifically in pregnant women or women who are breastfeeding. Okay. And a lot of that, we do know that pregnant women are at a lot of risk for are at a high risk for COVID-19 symptoms as well that can be harmful. So we recommend that women speak with their physician or their healthcare provider and see what's best for them based on how their pregnancy is going, maybe things with their baby. There can be a lot of different factors with pregnancy that may make the vaccine a good fit, or the physician's or healthcare provider's recommendation might be to continue social distancing and wearing a mask and to hold off on the vaccine. So we encourage women to have that conversation.
With their healthcare providers?
Yes.
Okay. Yeah. Let's see. How long is the process for the vaccine right now, for people who are going to the sites?
So I think it's a little different for everybody's experience and how the site is set up. From personal experience, I can share that my mother received the vaccine yesterday, and she said it was well organized, very quick. She said it was so painless and quick, the vaccine itself, that she asked the woman if she really gave her the vaccine.
That's good.
The
That's a
woman
good sign then.
She did. But testing is very quick. You're normally in and out within 30 minutes. And the goal is for it to be the same with the vaccine.
Yeah, and Stella, in a personal experience, I actually just recently signed up to get the first dose of the one of the vaccines, and it was a process where I selected the site once the face finder told me that I was eligible. I was able to just find one of the 20 different sites there. There's several 20 sites throughout King County that you can schedule or call or to get your vaccine. I was able to schedule myself within 5 minutes, I think, of putting all my information there, and I have my appointment within a couple of weeks. So there's a couple of weeks from when you're scheduled to when they're available to see you, given the number of people who are getting the vaccines at this time.
Excellent. Okay. I think that just one thing that everybody are asking, and I think that we ask this question over and over. So, like Vanessa and Swamhurst and Christina, all three of you already take your vaccine, right?
Yeah.
No?
Oh,
And I'm only eligible to take the vaccine because I actually I work in a specific behavioral health site, so I am in direct contact with people. That's the only reason I am directly eligible for the vaccines at this time.
right.
I am in 1B category, which is the one that just opened up. Wait, no, I'm in 1A.
Okay, back to the vaccine again. That I heard from some of my coworkers or my colleagues. They were asking, is it mandatory that if you work in a public, does everybody required, by the law, to have a vaccine? And if is it safe to say no, that you don't want to take a vaccine?
Go ahead, Christine.
Did you want to?
I was gonna tackle it, and then if I say something wrong, we can erase it, and then it didn't exist. But
It's okay.
so I just want to answer it by saying we understand in public health why certain communities and why certain people are hesitant to take the vaccine. So our job is not to be like everyone has to take it. It's more about providing information so you as an individual can make your own informed decision whether or not you want to take the vaccine. To my knowledge, there is it is not mandatory, and no one can force you to take the vaccine. Is that correct, Christine?
Yes, absolutely. Thank you so much. You give me 150% answer.
Stella, if I may, I think that there are there's many reasons on why our different communities may decide not to or decide to wait a little longer to take on this vaccine. And there's an emotional side to that, right? There's these fears out of that. That's understandable. What we're going through right now is challenging, and there's so much good news right now that we are getting better. Our numbers are getting slow. Mass work, socially distancing work. So let's continue to the work and support people who are going through that, who are hesitant about taking the vaccine. Let's offer them the correct information so they can make an informed decision, right? An informed decision to me is when you are provided every single aspect of education about something, and then you make the decision whether if you want to move forward with it or not. In this case, whether if you want to move forward to take the vaccine. I went through that process myself, evaluating my personal fears perhaps about it. And, it didn't take me long to decide this is I need a vaccine. I'm going to take it this time.
Okay. Sela or Netta, do you have a question at this time to follow up? Do you know why we have this great opportunity?
I guess I just want to see if there's any more information on the new strand of COVID, on the new variant.
So just to give you some background, how they find information on the variant is when people receive their COVID tests. We have centers such as Fred Hutch in Seattle doing DNA tests to see if that's a strain that we're familiar with or if that's a new strain to the area. So what we know is that there have been 2 cases in Snohomish County and 1 in Pierce County, but we expect there to be a lot more strains that show up. And what we know is that the critical difference is that the strain is more contagious. But we now, with all of the information that we currently have, the vaccines we believe will be just as effective against the variants.
Okay.
And I wish there was more that we could tell you right now because we're in the news so often and we hear about different variants in different states and what does that mean. And
right, such an odd time that we're all learning together at the same time.
Exactly.
Yeah. Oh, wow. Well, is there anything we want to ask? Anything else that you want to add to?
Yeah, the only thing that I could say, any other resourceful information, other than the vaccine, that you think that maybe like during this pandemic, like some kind of information about like household difficulties, like economic, that the King County have any resourceful information, to share with the community, or any grants or anything that may help if people wanted to apply for, or
I can share some resources about our well-being and psychological well-being. If you visit kingcounty.gov/COVID/support, I'm going to put that website here in your link in your chat box as well. It is a fantastic source of resources for in-home support, food, and other items such as that you may need as people are being impacted by COVID-19. Additionally, it can also have it has resources on emotional well-being. It is a great place to gather information and to connect people. This will take you to the website where we contain all the information about COVID-19 as well. So I invite people to really take the time and go through it and to really seek the support. Call 211 for any support, any needs that you may have, that you may need support, you need to find resources. 211 is a great resource for you to call and tell them I'm looking for support with food, support with mental health, or whatever type of support you have. They will point you in the right direction. That's one of the greatest resources King County has at this time, to really point you and connect you to the right people in these times in these times where you need support.
And I just want to add on to the resources for anyone who's watching. www.kingcounty.gov/COVID/Tongan for public recommendations in Tongan language. And they also have all the other languages for most of the other languages for our islands.
yes.
So if you want to drop in there, I know Sela dropped the link in the description. So thank you for that. And yeah.
There's also a helpline that will help with testing medical questions and resources, which is 206-477-3977. And you can also email coronavirus@kingcounty.gov with your questions.
So is this like a 24-hour line?
I believe I would go with Swamir's recommendation for more urgent help. And this line, I believe, is staffed during business hours.
Okay, so it's 206
206-477-3977.
Okay, ko ia e kainga tonga pe ko e taha pe o ko whanongo mai. Ko whika telefoni e taimi o ko e ma o hato koni. Ko whitu tak whanga tona pe ko ki telefoni ko i wanoa ono. Wha fitu tolu hiwa fitu. Wanoa ono wha fitu tolu hiwa fitu. Thank you. That's the helpline. Well, I have one question. It's kind of a little out of the blue, but I wanted to ask it, like, to close it with our dialogue and the great information resource. Netta, do you have any more questions that you think it's relevant since you working with the Pacific Islanders Health Board?
No, I believe I asked what I want to ask. Yeah.
I have something.
Go ahead, Stella.
Okay, go ahead, Stella.
Given that there is a lack of trust with this vaccination and everything going on, what hopeful advice do you have that you've seen in your position that you can give to the PI community, especially with our community being the highest rate affected? Yeah. I don't want to try and persuade folks to go and get the vaccination, but what kind of, hopeful advice or encouraging message do you have for folks who don't believe in it or who just don't believe in anything that's going on right now in general?
Yeah, that's a great question.
Yes, that's a great question.
I'll say that perhaps that is a good and challenging question, I would say, because we are all different people who have different systems of values and different systems of seeing the world. And right now, there are really good reasons for why people want to take their time in making the decision and take the vaccine. One of the things I told myself in the process of deciding to take this vaccine myself in a couple of weeks, it was that taking the vaccine is the right thing for my family, for my community, and for the people that I live with, right? Taking the vaccine it's not a political statement. It's not about it's really about me being respectful to my people, to who I am, what I represent, and that was my conclusion. Taking this vaccine is not only a good thing for me, but also the thing around me. And I know that the API community it has a similar value like the one that I hold, right, where we hold our families so close to us, and this is why we as people who have this communal way of living and communal way of interacting with our people must make this choice not only for ourselves but also for the people around us, and that is perhaps the best way for us to really to tell our community that it is important for us to make that choice in your own time, ask the right questions, talk to the right people, and get yourself informed in the reality. There's a lot of misinformation out there. We live in this world of social media, yet the right information is the information that is being presented to you today by the Department of Public Health. That's being presented to you. I just have to plug that in there. But it's really about informing yourself on the right methods, not seeking information in places where they don't have the proper accreditation, perhaps, to provide you with that information, right? And again, it takes time. Sometimes it would just take some back and forth and acknowledging, asking questions. Yet you will come to that conclusion to yourself for the better of your family and for the better of your community.
Yes.
Thank you so much. I really think that this is one of the best, dialogue that we can get engaged, with all the officers, from King County to come over and share this essential information, and it's very relevant. Ako fu anga pito nga information ko ni kai nga tonga te mauta tuka tu pe ia I he website, there mo Facebook and also the YouTube. Ke lava ke mo whanonga tonu ke ngai whale I kono o mai me King County, ke tokoni kia te koe mo taha kota pe I community, right, Neta?
Yes.
This information is not just about us. It's going to help you and others, and everyone in the Pacific Islanders community.
Absolutely.
Yes. I think my last question that I just wanted to ask, unless if you have anything else to ask.
Or as them to add.
Yeah, if you have anything to add.
Okay, the things that I wanted to add on to our um, conversation, with all the COVID-19, the vaccine, and everything, that's very resourceful and thought about the future to allow us, to come out and, be cured and stay safe and strong with everyone else in the community. About a week ago, I just saw something, but then it was not coming from the media or the news channel, and it was just like on a site, some scientists study individually. And some of them, just saying that the amount of people that are dying is just the same amount of people that died before the COVID-19 exists in the country. But because right now during this pandemic, everything is all claimed that's a COVID-19. I'm just trying to clarify that because they said that same amount of people that passed on these years ago, it's because they have a lot of medical and health problems, and people can die from accident, cancer, and all kinds of, death result. But it's not all the amount of people that passing right now because we have about like 300 million, population in the country. And I'm not saying to put anything down. I'm just wanting to get the fact, is it true or not? Or that's just like a myth?
Christina, I will let you answer that question. I would like to follow up after your comment.
Yeah, and I don't know if Vanessa, she may have some numbers as well. So I think there are a lot of variations of this, whether it's people saying that it's not COVID who killed somebody, it's that they had cancer, they were older, or that they had pre-existing conditions. Or I've also heard, but it's only 1% of the population if you take out people who are 70 and over, or that death is a normal thing and people get old and weak. And for me, that's always really hard to hear because we know that all of those other conditions existed before COVID. And what we know is that a greater amount of people are dying during the pandemic. And there's not really a way, when you look at 400,000 individual lives in the US and more, you can't really cancel those out. Those are 400,000 people who have families, who contribute to our communities, who help build up our economy in different ways. And those people have died, and there's nothing outside of this virus that could cause that many more people in the US to die within 9 months than who did in the year before. So I think quite logically looking at that, and also looking at pre-existing conditions, there are a lot of ways, a lot of these conditions are not, do not default to somebody dying. We have really fantastic cancer treatments, and we have treatments for diabetes. And even though there are people who are temporarily weaker, who are more susceptible to the virus, if that virus was not there, they would have the chance to heal, and they would have the chance for treatments to work. I'm going to let Swamiers and Vanessa jump in.
Yeah. Thank you, Christina. I think, this is there's several examples out there on how information is being misconstrued or perhaps not being understood properly on the right or presented on the right format, right? So we know that there are people, there are community members throughout the country. Don't we have over 300 million people of them, and some of them who struggle with some underlying conditions. Right? I myself, I have what's called the opposite of diabetes. I don't remember the name right now. I'm hypoglycemic, right? So which that itself put me at high risk for COVID, right? So we have to understand one thing. Yes, if I were to get COVID, right, and I have an underlying condition, the result of that may be it may be death. However, it's not necessarily that what didn't kill me was perhaps it wasn't the hypoglycemia. It was the fact that COVID-19 made my condition worse and then made it and got me somewhere, right? So I think this is really one of the important parts that we have to understand, that people with pre-existing conditions are disproportionately, are the ones being impacted the most. But what's perhaps taking those people from our country, from our communities, is not their underlying conditions, but COVID-19, to then created a medical challenge for them and resulted.
Yeah, and I just want to wrap it up by, the one number that I think is really important is that 400,000, right? Like, in this past 9 months, we have lost 400,000 at least, right? 400,000 Americans to COVID-19. The stories that you hear of people talking about like relatives or loved ones being impacted by this disease, it kind of just speaks to the fact that this is real. Communities are being affected. Certain communities are being impacted more than others. So it's just up to us to do our due diligence to make sure we kind of keep this under control as much as we can. And you all said it, right? We're in this moment where we're all learning at the same time. And everything that we're touting is very much like what we've learned in the process. And Washington, we're doing a really good job, right? King County's doing a really good job. So it's just a matter of like keeping it, we're in this for the long haul, but we're in this together. And that's all we can ask for, is just that folks continue to do what they have been doing.
Thank you. I think at this time, like for those of you that may have a question, we're running out of time. 206-651-7552, but I have someone that asking a question right now. Neda, go ahead.
Yeah, we just have a question from one of the community members. So they took the first dose of their vaccine and nothing happened. The second vaccine is going to be on the 1st of February. They're wondering if it's a risk, or is the second shot going to be more painful? I have heard that it will be.
So that's what we're finding. That's what researchers have found. So the first injection, like you might get some like mild symptoms, but it's typically after the second one where the symptoms are a bit more severe. But the symptoms are very much reflective of the fact that the vaccine is doing its job. It's getting your body ready to fight it should you be in contact with someone who has COVID-19.
Okay. All right. Thank you.
I don't know if I'm so sorry if I'm keep asking, odd question, but this is my last one, but just help me, because I'm just so curious.
That's her normal.
The question is, and I heard that from a lot of the, especially with older folks, like 50 years and above, and they said when they wear the mask, of course you have to protect yourself and you have to protect the other person too from spreading the germs. But they said it's like really giving them, like a low oxygen, and it's so hard for them, for their breathing. But when they take off the mask and they breathe, the fresh air, thus it's the mask, because they believe that sometimes you breathe out, the air from outside, you breathe out, and then you kind of deposit back that air back into your system. How does it affect the body or not? I think that's my question. Wearing the mask, you're breathing out and breathing in with the same air.
I always like to point out that as long as we've had modern medicine, physicians have worn masks, and we know that physicians will go into surgeries that are 12, 14, 16-hour surgeries in severe cases, and they will wear those masks the entire time. And we know there's not adverse effects. So I always like to think this mask wearing is new for the general population, but a lot of people in different professions have done it for a very long time. And these are health professions. So if there was a health risk, it would be flagged and something would have been changed by this point. But I think it's very real that some people are bothered by masks, and whether it's having something cover their face or it being something they're not used to feeling. And I always suggest that people try different styles. Sometimes your mask will be really soft fabric, and that goes against your mouth more when you breathe or talk, and maybe that's bothersome. And you can get a mask that's made out of stiffer material or maybe shaped so it goes out. So while it's understandable that sometimes it feels that way, it is safe. And what's safest right now with the variant is if your mask is well-fitting over your nose, no gaps at the sides. And if you're feeling very uncomfortable in a mask, I'd encourage you to try different styles.
Or brush your teeth.
Okay.
I'm just kidding.
I worry that I have them. That I don't know if I have things in my teeth because I've been wearing
Okay. Thank you very much, that we have all this great information to share with the community. Ko iai kai ngā tonga pe mo e kakai me Pasifiki. Ko mo whananga peke polo kalama koe ahoni mo wahe atu ki a taha pe. Ko ngā te nau lama whananga whanga tonu ki kau science test koe ni. Aia koe kau whakatotoro pe ki kai ngā tai. So I got one person one is the science test, right? Is that Vanessa?
Vanessa, social research scientist.
Social research scientist. And Swam, hers?
Is the behavior.
I'm a psychologist.
There you go, psychologist.
Oh, that we should have asked a question about. Maybe in our next round, we can have that because that is something that's very, very relevant, to our community. That we've seen that, like especially during this pandemic, anything, especially with not only with the health support, but with the mental support, it's affect a lot even with the young people, and that's what needs to empower others, during this difficult time, and also to make others, like I heard that one lady, she said, I'm sick again. And I said, why? Are you getting COVID-19? No, I'm just sick, for being lonely. So, and that's what I'm saying, that I think it's very important that you can, you guys can come back, for a second round because we need to fit in all this relevant and very essential information to support our community, with all this great information that you shared today. Again, thank you so much, and thank you all for coming in.
So we're going to do a dance for you.
Yeah.
We'll give you one more song to do the final dance.
And she's going to do a dance.
This is called.
This is from her village, actually, right here.
This is like called a farewell dance.
Yeah, right here.
Our farewell
Thank you.
What song?
Okay, she.
This is
the
it.
The dancer has a special song request. Is it this one, the Mahina song?
Yeah.
Okay. Okay, this one.
Yeah. Okay, go. Hey, take a hit. Yeah.
Thank you.
caught by the tiger. Yeah, that's like a tiger egg. Okay, thank you again, for the Pacific Islanders listeners. We have Vanessa and also Swamhurst and Christina from the Public Relation Communication Specialist. Thank you all, and we greatly appreciate taking your time to join us today and share the great information with everyone and things that will help church, families, and the community during this difficult time. Thank you all. And stay safe.
Thank you for having us.
Thank you.
Bye-bye.
Welcome. We're gonna see
Have a
you
good
next
night.
Aloha. Okay, ta era foi fácil. At leva ta foi fácil ko ni hoko ke ki to fa mama fana ke ta polo kalama ka ta ki fare at malo mo to ko ko ni amiri tu po mafi all the way from New Zealand malo opito si kau mai le a pe fo ke a fa ta pa to tai le mo e fa malo ke ta polo kalama ke ngai vai au nga ko ni to te pi mo la tonga malo opito ko ni ke twisi ai pe ko ia I he fasi ko ia e kolotala Yo, pe foki ke kuin wa hoi ka waka mo Pacific Flowers ai ko Pacific Flowers ko no tala mai e ki ka technician e te ke matala ka ya pong e toki matala ke ka ha ko moi tu tau malo opito offer to brother malo opito si ka mai pe foka ki moto ko to pe loto ni ko ki lava o sio ka to ko mo hingoa ka fa malo atu ko polo kalama na moto me mai kai ko polo kalama ya ai King County ai ko na kau anga na kau ta ka to tolo ko kau sai nisi ko na wako ki he ngai mahaki ko ni NPP pe foki ke communication specialist ko ya ko Christina ai angale lei pa na foto to polo kalama ko ni. And also shout out to you, Mary Rapon. You're probably listening to us all the way from where you're at, from the other side of Haven. Okay, eta eleveta foi faskoni at ka ki moto ka tau ki hoko atu ki e tau ngai tu a ki mo tau ngai whanawa nongo ko ia ki he ahoni.
E hoko maupe Folau ka pasamei he ala tau whai Amerika lahi mo ono folaua ono e a whakalata mai ke te kita ki te noa maupe si ifugasia te ui behi wape He ala o manongi o e kau mea Tuku ke mo o ni a e ki ilea Nisi e fuku o wawa kone a whaingata Pasamei he ala tau whai Amerika lahi mo ono folaua Hono e a whakalata mai ke te kita Ki te noa maupe si ifugasia Vape mo fia fia He ala ha o manongi o e kau mea Tuku ke mo oni a e ki ilea Misi e
Hello, welcome to Fiji Bazaar. We are here to help. Largest collection of Indonesian and Polynesian and Micronesian community. So you're welcome in anytime. We are open 7 days a week from 10 o'clock till 7 o'clock, and Sunday is 10 to 4. So all of our leaders are welcome. Indian, Pakistanis, Polynesian, Micronesian. We have all the community stuff right under one roof. Thank you.
Ko ia hoi ki pa mo e kainga tonga ko ato e whakawheni. Ki mo tau ko ia ko mo puputu o mo ngai whakakaukau pia mo ngoi whaingata ia he taimlahi ia hoko maha ngai mea o ko ke kau whatahai i he ngai mea whakalao pe kano whaka ilo koe pia ka ngai mea o ke ilo i okta e totonu ke kawai ko i ngā pē ko i kai ke ilo ki he totonu a au. Ko e whetū take whangatona koe ke liko sio i he taimini. Ko e liko sio te nau tokoni kai te koe ke ongo i whia maalie, hou e wha aho e whitu o i wike. Ia whai ngā taimi pe. Ia iha mea o whikau aki moho mea lele a pinofo anga ngā we. Pē koe hā pe ha mea kai oa pe na ake tukua ki i koe ki a whahinga mea o ku i kai te ke ilo ki ai. O kia i pe whakpea mai nau ngai tokoni ke ngai tawaki koe ia whaka immigrationi ke nau o atu hakau loia ke nau tokoni i koe ke mau ai ngai mea koe ia o ke whaka amu ki ai pea oa na a hoko ia koe mea ke whamau mau lao ai pea tukua ki ai koe. Whetū taka ke peko i telefoni koe ia a Haloti Puloka. Aia ko Michael Haloti Puloka koe telefoni koe ua noa ono nima noa wha hiwa whitu ni mataha. Ua noa ono, nima noa wha hiwa whitu ni mataha. Ma ngai mea peo whekau aki moe lao, moe tutu ni. Pea ke whetū take ngā tona ke peko i ki ai. Ko i ngā o ke ai pe nau kauloe a hoa e ua whae aho ke nau tongoni i koe i a whahinga taimi pe. Telefoni koe ua noa ono, nima noa wha hiwa whitu ni mataha. Whetū take ke peko i ka viri ami Haloti Puloka. Hello from the Fiji market. It's well known throughout the Pacific Islanders. Koe market tino iloa koe Fiji market o ko mea ia e he tonga kotoa pea moe kāinga o i Pasifiki. O wawa ia aho whitu e wike, pea nau tokon lahi apito, kai ke ngata pe i he ne maa ka koe ngai mea tokon lele ni o ko hau hangatonu ia pea me he Pasifiki. Ko ia koe tokotahe ni ona ko ia o i wharekoloa, ia hello, Mohammed.
Hello, Sylvia. Hello.
I would like to welcome Mohammed. He's the owner of the Fiji market right now. Before, people known Naresh was the former owner, but now we have a new owner of the Fiji market, and we have more product right now. Yes.
Yay!
Thank you much. So, Mohammed, I would like to ask you, tell us a little bit about the Fiji market, so that people can be well aware in what you have in the store.
Thank you, Sylvia, and thank you all the islanders for providing me opportunity to come today on your transmission and introduce myself. So I think a lot of people, they know the Bombay Fiji Bazaar is in the market from last 15 years, serving the Polynesian and Micronesian community, along with the Fijian community as well, Indian, Pakistani, a lot of other some African communities as well. So I knew Naresh from last 10 plus years, and then is a family, like we were like family, and they wanted to just retire and want to give it to someone who can keep the same legacy.
Yes.
So last year we were able to just talk to them, and then it's been almost 5 months that we are already running. We are operating it 7 days a week. Monday through Saturday we are from 10 to 7 p.m. and on Sunday we are 10 to 4, open major holidays as well. And as you know, we are one of the largest selection of Polynesian, Micronesian, Fiji community, Indian, Pakistani as well. And we are growing this business because of all you guys help. Like everyone is welcome over here. People, they were having in their mind a lot of people that this store will be closed and will not be operating the same way. But by the grace of God, we have been running from last 5+ months, and so far very positive feedback. Thanks to all you guys for reaching out to us, and we have been increasing our inventory. And in this pandemic as well, like we are trying to serve the community, keeping our selling costs as much low as possible. Definitely, at some aspects, our hands are tied because of the COVID. A lot of products are have shortage, and then at the company level, they have increased the prices because a lot of prices have gone up. But from our side, we are committed that we will keeping the price as low as possible. So all the products, whether it's corned beef, whether it's flowers, like all the snacks, everything, we just want to keep it as low as possible so people, they can come and shop with the same freedom and with the same trust that we're always there. So, and also I just wanted to mention that like a lot of customers have approached us as well, that there are some new people who are coming to the market and claiming themselves as our second branch, as Bombay Fiji Bazaar second branch, and they are just keeping the same setup that we have over here, same products. But we just wanted to let you know that we don't have any second branch. Hopefully, when we will open our second branch, definitely we'll come to you guys. We'll update everyone on the social media as well that we are opening our second branch, and we'll see how it goes. But it will come with the time.
Okay. Wonderful. So I just wanted to confirm the time of the business hours is like from 10 to 7 from Monday through Saturday.
That is affirmative. That's correct. Monday through Saturday, we open at 10 to 7.
10 to 7, 6 days a week. From ahamonite ke ahtona ki me hongo fulupongpong ke time fitu e fiafi. Pe hongo fulupongpong leo ki fa isapate. And 10 in the morning till 4 p.m. in the afternoon on Sunday, right?
That is correct.
Right. Okay, what is something that I noticed that just a lot of new stuff, in the store? Do you see anything like compare the price from before or some other Polynesian market or any other Pacific Islanders market? What is the comparison of the price? Do you want Pacific Islanders to come over there? Do you think that your price is affordable and we got new stuff and new products, from your store? Then we can get it any other place else?
A lot of communities, in terms of lamb flaps, lamb chops, lamb necks, moonlight biscuits, all these products like bongos, full range, Pretty soon you will see our ad as well through Sylvia on the social media as well. And whether it's lanyards, lava lavas, I'm getting a lot of those as well. Um, like earrings, quick necklaces, like you name it. We are
Right.
trying our like hoodies. Our one of the best sellers that we have hoodies from all the islands, and the list is going on, and it's all because of you guys for supporting us, our small business, and coming and giving us a feedback. Because of your feedback and what people want in the market, definitely they want to come and shop at one place under one roof. So we are just trying to bring as much diversity as we can for the stuff to bring in. Definitely our price, like it's not like it's my store, that's why, but I have seen people coming and telling us from different states as well, and just let you know, like we are the wholesaler as well. So like a lot of people from north and south, they come and they get the wholesale stuff from us, and we are one of the biggest supplier as far as I know, one of them. Like there could be multiple people in the market, but we are trying our best to be just to maintain the name and become one of the biggest name in the Polynesian and Micronesian market. Whether it's a retail or the wholesale, we are open over here for all type of businesses. Even if you have a small business and you want to sell some product, just come and meet us, and definitely we will be here
How
to
nice.
support any kind of small business.
Thank you so much. I'm so glad that you said, like even kapag haoki business or you want something to advertise, they are more than welcome to come. Yeah, that's it. They're more than welcome to come over, and they are going to support you because we're supporting each other. I
Exactly.
go market in loa I he tau Pasifiki. Go market I fisi. O tau fo iwi big market fisi right on Military Road in Kent. Aya ku kai ki sola kia hataha. Aya ko market in na tau lah ya ngawe pe kia I hono partner pe ko retire bane o angle pe business ki to ta pe ko ni. Ko ia ko market fisi na unau to ko ni unau help us ke sponsor the Voice of South Pacific. Thank you for your sponsorship, and everything. Is there anything else that you think that that will benefit, our people, like coming over to the Fiji market more than going to any place else?
I would recommend, like if they find something that we are missing, just kindly like update us so we can just bring it as quickly as possible.
Right.
Definitely due to pandemic, a lot of things are like have a shortage. We apologize for that. But regardless, like whatever we could do for the community, we are here. Like a lot of people, like just God save everyone from that. But this is a part of life. If they have funerals, so we do some special discount on the funeral items as well. They come. I know every like island they have their specific customs which they follow, but we are here to help. Whatever we could do, just reach out to me and my brother Mohammed. Both Mohammeds over here. So we are here to help and support whatever we could do and whatever cause it is.
Thank you so much, Mohammed. I'm so glad that you came in and joined us live today so that the Pacific Islanders community can actually see you. And everybody loved the store. They have the taro leaves. It's like palusami and lusipi, and you have everything. And the fresh fish come all the way from the Blue Lagoon. And we have all the necklaces, everything, earrings. Oh, here's my flowers. I got it right from
Yes,
there.
yes. I spent 4 hours before the Christmas to just get all the stuff for ladies, and we are getting a really good positive feedback. So my time is paid off.
That's good.
And we love the Fiji market because it's so convenient. It's just around your neighborhood, just like a one step away.
Yes.
And the Fiji market, I like that. It's like reach out and touch someone. You one stop does it all. You come to the Fiji market, you get everything. Like you go to the Mid East, you get everything in there. You go to the Polynesian, you go to the Micronesia, you got everything in there. So this is like a one roof that have everything. So you don't have to run here, run there, run everywhere. You got it all.
We just got new blankets as well, Sylvia.
Oh, okay. We need to get a blanket right now to keep the COVID-19. To keep the COVID-19
We want to
away.
make sure our community is warm, very warm.
You need to stay warm. Come and get your blanket now. Thank you so
Thank you
much,
so much.
Mohammed. And now we're also playing, the advertisement. Thank you for your sponsorship. Thank you for your support. And we are
You're
also
welcome.
there to do all our shopping. It's like one stop, does it all. Thank you very much, and the welcoming spirit
welcome.
when we come in.
Thank you so much. Thank you
Voice
everyone
of
out there
South
who is
Pacific.
watching us.
Yes.
And thanks for your support, and do support Pacific, Voice of South Pacific as well.
Yes, and here we're going back to, if you're just gonna stay tuned, we're gonna go back to we're gonna go back to the video, like from the market.
Sure. Thank you so much.
Yeah, you
I'll
can just stay
see.
right
I'll
there
see.
and watch it.
He can't
Right
see
there.
it.
Oh, you cannot see it? Oh, but you can hear the sound? You can hear the sound?
Yes, I can hear the sound.
Okay.
Yes. Whoever edits the video is very good person.
Right here. Welcome to Fiji Market.
Thank you guys.
Thank you, Mommy. Here comes the advertisement.
I'll bring some more products and show the videos.
Yes. Thank you for sponsoring the Voice of South Pacific podcast.
So right now it's 7:30 and we're still at store. Why don't I advertise something?
Wait. Go Fiji Market. Yay. Fiji Market.
Only for
supporting us.
Sylvia.
Yes, Voice of South Pacific broadcast.
Thank you so much.
Pacific
Thank you.
Islanders. Remember, we're on a YouTube and we're on the Facebook.
Thank you.
Thank you so much, guys, and nice talking to you.
Yeah, we'll
And
be
hope to
seeing
see you
you
guys
all the
soon.
time.
Thank you.
And
Bye
we'll
bye.
assemble first.
Bye.
Yeah.
Have a good night, guys. Thank you.
Okay, thank you. And you're gonna join us live again. Yeah.
See you next
Thank you,
time.
Mohammed.
Bye bye.
Thank you. Tofa Soifua. Pula Vinaka. Can you run the Fiji Market advertisement one more time, please? Okay.
Hello, welcome to Bombay Fiji Bazaar. We are here to help. Largest collection of Indonesian and Polynesian and Micronesian community. So you're welcome in anytime. We are open 7 days a week from 10 o'clock till 7 o'clock, and Sunday is 10 to 4. So all of our days are welcome. Indian, Pakistanis, Polynesian, Micronesian. We have all the community stuff right under one roof. Thank you.
Koe kai ngā tonga, mō toki me amai a ke ngahi kawha wha fo whataha, pia mo ngā we wha mea a e ki I whine mui tonga. Koe kautaha koe niu iloa ia koe amanaki lelei taimi. Koe o ate ngai kawha ke tuha mo tāu pia mo ho whi mau. Aia ka pau te ke toi tui ala hatu pia toi whakaafo whātu. Ai whakaafo ho tui pia mo ngahi kupesi ke ahono ngāhi. Ko iai o ta lewa hao ka whai ahoni, he kufu matu aki whakaatu I ahono totongi. Pea ko ia ke tokoni ke ki whamiri. Ko whetutaki whahanga tonu pe koe ki lelei taha, ko aluhanga tonu pe koe ki he messenger, aia koe FB messenger ki a Celia Taimi. Pea o kui kai ki a hame aini ke utoi talaihanga mai, ke ko lahi au pito ai kakai ko nau ota nau ngai kawha, pea ko nau fu matu aki fia I e totongi ene whakaatu I, mo ene maa kai toi amuatu ai ene whakaofo ofa. Ko ia whitutaki a grewa pe koe ki he messenger ki a Celia Taimi, he e kupau mo oni pea I kai ki ngatai, o kufu matu aki malu pea hao ki a koe ai taimi te ke whakapotala noa I, ke o atu ai mea o kuke fie mau, mo ho o ota, pea te mau sena tia I he wawe taha. Whetutaki a pe koe ki a Celia Taimi, sa ila I a Taimi. O whetutaki a pe ki ai I he messenger ke ne o atu. O, ko toko taha I he laine, o whie kau mai ki tau polokalama, whie kau aki pa mo ngai kawha koe ni. Malo lelei, ka taki o whahoko mai ho hingoa, pe koe haha o ki vahe.
Hi, my name is Ui Tongan. I'm calling from California, and I just wanted to kind of call in and give my testimonial about Celia Taimi's handicrafts.
Right.
I've been buying from her for different occasions. Like just last year, we had an engagement, we had a wedding, and both times we ordered straight from New Zealand. She shipped it over. It was beautiful, and a lot of times, it's not something you can get here from the States. So
Yes, right.
It's special and it's beautiful. Everything she makes is so nice. And we actually just put it in order. Even though with the COVID, we're still getting married. People are still getting married. We're still having engagements. Praise the Lord. So we just have to put in another order because we have an engagement coming up in March here in LA. So I went ahead and already put in my order. I can't wait to receive my kafa from my sister. She's going to look beautiful on her day. And then come her wedding day in December, we're going to order again. So anyone out there looking for something different, special, and straight from the source, go ahead and order from Celia Taimi. She's awesome.
Oh, thank you so much. You know, what a wonderful. Do you have anything to say, Neta?
Yeah, I actually have a question. If I was to order something right now from Celia, will it arrive before May?
Of course.
Okay.
Of course. Like your question, let me answer that. I got ko kafa e tolo kehe I api. Pea na e o mai ko kafa ko yana e ni mai kafa. Pea ko le vaia e he kau me atonga ke nau whakatau. Whaka ofa au pito. Pea nau whakatau because the price is very reasonable and affordable. And the best thing to know that is the trustworthy and the safety. That's what matters. You know, you cannot buy anything cheap or anything, but otherwise you don't get what you want. This is the high quality, and I have to say, yes, I bought some myself too. Yeah, so that's why I'm putting it out because I wanted to share it with our Pacific Islanders community. You know, I won't share this if it didn't come to me. But I see that, and I'm so glad that I come around and see this. Thank you so much, you know, for these great resource, and then also like for your testimonial, you know, ke ngai kafa ko ni. Ko ia ko no ko ka tak mo sela ka ke to tuku ia te mo aia. Ko inde mau to atu pe ata ke mo me hanga ton mai pe ki ai. Ko to ta ko ni o ku fai to tonu au pito. O ku fai to tonu pe aku ne matu aki malu. Ai me akotoa pe ako falala anga ai me akotoa pe ke a watu ho o ta o whakatatau ki ho o whia mau. O whakamata pe i he ki pāngai wangi au poka ki pāngai te au. O whakatatau pe koe hae mea o kuke o ta. Ka koe ngahi ngau wha mea a koe ne o ne whakatau atu. O fumatu aki whaka ofo ofa ia o tuha mo tau pe am ho o whia mau. Ka koe mahu i ngā o toi am watu a ene maa maa. Koe ai. Whetota ki hangarewa i he ahoni ki a Celia Taimi, ki he Messenger, i he Facebook a. Ki mō lava pe o tala noa whahanga tonu, ko ngā ke awe ki a ho o ta. Te agapau pe ko ki mō tolo i Amerikani, ko ki mō lava whetotaki, te mō lava pe whetotaki mai ke whika telefoni ko i wano aono, tolo noa ni ma walu o ua, ko ngāhi ota ko ni e o mai, o alu hanga tonu pe ki ai, pe hau hanga tonu pe me ai ki a koe, pe a okune eke mau pe, ai me a koia o kuke loto koia ke design ki ai o whakatatau pe amho o whia mau. See design everything according to what your need. It's not what she make, but everything goes, you know, according to what you want, and the quality is above and beyond. Kamalo atu eri au pito pa ko kolet makasela ke katafa mole mole mo ka te fa ari atu ai u ka fa fofa koini. Koe ai kai ngā tonga, koe hange koe tuwaki koe ni, koe amanaki lelei taimi ko hingoia ia kauta, amanaki lelei, koe ngā ko amanaki, it has to be met. Pea koe hingoa, koe Celia Taimi. Koe ai koe ngā ue au fuatoa koe ni ai whae koe ni, hepsi ai ki i foha o ku si itala sisi o ne fukei vale vale au pito. Ka koe uhinga koe ne whenga ke oana hili whaki mai ai mamahi koe ni, te koe whangataa koe ni i he pahoa asa ki koe, ka une ngahi a ngahi me a te whakafofa, ngai kawha kekehe, ngai kahoa me kupesi kekehe, whatatau ki o whi mau. Ko iai, whitu tak whangatona upe koe i e Messenger ki a Celia Taimi, ki o mai me iai, ai ngahi ata ko ia o ku ke whi mau, pe te ke ota hangatona pe me iai. Pea o ku i kai ke toi whakaalonga ua, o ku hau hangatona pe ia, Ko tawat pe a seniti o kune osili mai pe ia. Na moe osi pe wike taha ko osi a umai ki Amerikani. Te ko whea pe hatuli ke whaekolo pe Australia, Tonga, New Zealand, Amerikani. Mo whitu taki whanga tona pe ke Silia Taimi Messenger. Ko ki seniti o mau e tokonia ke whaito o tala sisi a hono ki foha. Ko ia te uwhata te utatau atu he, ka ko atu a whamaloka ki mo tolu kotoa, malo a pito mo mea mai, ki he ngai kawha whakawhawha koe ni, ke tu wake te maki mo tolu. Ko lea ten ka sela ka taka te tae matau ki whaiwhasi, ka tau hoko atu ki he ngai whanongongo ko e ni hoko.
Hi everyone. I just want to bring to you that we will have a food truck distribution next Friday, February 5th, 2021. It will be at the Best Western Plus in Renton Inn. Address should be in description, or I can say it here. 1850 Southeast Maple Valley Highway, Renton, Washington, 98057. Brought to you, we need volunteers, so any of you, if you can, for Friday, hit up Voice of South Pacific, API Chaya, or Pacific Islander Health Board members. Sela Lilo, 206-335-6824, or me, 307-690-8441, or lovely Tima here.
206-305-8222. We need some volunteer koe whanongonongo koe ko atu koe amanake whai tuwha me akai e whalaite koe a wika hau. Aia koe whihaka, what time again, Neta?
I believe, I do not know the time. We'll get the time to you guys before
next Friday.
Yeah.
Te mau te announce te pe ai taime koe a o e tuwha koe ni ke whalaite ka hau. Ka e whakaho koe a I he Best Western Hotel koe a I Rentoni. Pea koe Best Western, aia o kui he tawhaaki pe koe ia o e wharekai koe Sherry's I he Maple Valley. A Maple Valley Highway, aia o ko mea ia e to he toholahi. Pea koe ia e te mo lava pe o aluhanga tonha ke pe ki ai. Aia koe tuwha mea kai koe ni o ko sponsor tuia pea me he Voice of South Pacific, koe to koni to help you and help everyone else in the community. Voice of South Pacific, reach out and touch someone. Ko iai, ko mea kai kono tuwha tu ko ni e mea, ko ngai puha mea kai au hao hanga ton pe me ngai whama, I he aho whalai te wika au, te mau toe atu peo whanonongo atu, ai ngai taimi ko ia ke mo mau pick up mo ngai puha mea kai, ke ewa nā ongo I ha taha o whainga tā maki. Ko e toi whanonongo ne taha, ko e ngai keke whakapaku ko ia o mo whi mau, ngai keke isi te I fo pe amio, mau pe, ma whana ko taimini ke aia hau ki vai ma whana. Ko whetu taki ake pe koe ki a lātu hoa kau. Ko e taha ia kau whaipol kalama ko ia ai Voice of South Pacific. Ko e wana ono, hiwa taha tolu noa o noua. Wana ono, hiwa taha tolu noa o noua. Ko e keke whapaku isi te ia. Mana tui, whaahinga taimi pe ahoe fitu I wike. Hoa I wa wha moe ahoe fitu I wike. Ko whetu taki ake pe koe ki a lātu hoa kau. Wana ono, hiwa taha tolu noa o noua. Pea koe ai o whamanata atu pe e mō ngāwe aki ai ngai whainga maari koe nung mautuku atu. Koe ia koe whanonga whaosi ne taha. Toi o atu pe mo ia, ko ki mōtolo koe ia o whe mau te whakakau ke whakatau hao api nofo anga. Tuku ai whakamore ki ho seniti, I ngai apartmeni ma ngai whale reni. Kai tau hi ai seniti ke totongi ake pe ai whale ko o invesi. Koia ko real estate broker ia falala anga au pito pe aku matu aki tokoni au pito ki kai ngatonga. Aia ko Rosie aho ia ko telefoni ko wano aono. Valu ni matolu fa aono no aua. Ua no aono valu ni matolu fa aono no aua. One more time 206-853-4602 ko real estate broker ia ko Rosie aho. Ko ia mo fitu take le pegi ai ko ua na ono, valu ni matolu fa ono no aua. Te tau ata e peri pa mo fika ko ia King County, ki mo tolu ko whea mau hatoko ni ke helpline. Neta, ke mau e fika telefoni, ke helpline ko ia King County, ko ia ka pau ke whea mau ha whainga toko ni a whainga taimi pe. Ha whainga ta a ia whaka insiwa, whaka mo ilelei. Pe ko hangai whea mau whaka vawe pe ko hape ha mea, o kuke fie mau, e ke fitu take pe kone tu kwa te neta fika telefoni.
E ua noa ono, wha fitu fitu, tolu hiwa fitu fitu. Ko ia ko fika healthline and all the resources that you will need that affected you during this pandemic.
Malo opito neta koe, mako me ko katoa ia mau ngai whanongono ko atu lava ke o atu i he ahoni. Pea ma wha malo tene tau ka whataha, te whamanata e peheni. Koe Fiji Market, ka pau o ke whia mao ke ilo pe o ki ai halu, pe o ki ai hasipi. Nā ke hela iha whaka uri ki ai. Koe whika telefoni ke tohi i hifo. Koe ua ni matolu. Walu tolu hiva, noa ua ni maua. Ua ni matolu, walu tolu hiva, noa ua ni maua. Koe liko shio. Pe ko ngai kau tahlo e aia o ku lava pe ke tokoni ke te koe pe maa au pito. Ko fika telefoni ko wano aono ni manoa fa hiva fit ni mataha ko Michael haloti poloka ia. Ko King County ko wano aono fa fitu fitu tolu hiva fitu fitu ko helpline ia. Te ko real estate broker ka pau fia mao ke fa tau hafale pe ko fa kau ke palani ke fa tau hafale in the future pe ko ka hau. Telefoni ko wano aono valu ni matolu fa ono no aua. Wano aono valu ni matolu fa ono no aua. Ko e mahalo ko ngai telefonia o kulava ke o atu i he taimini. Na mana tu whake ngai kafa whakaafofa mo lau lo taha, ai ngai kafa ko ne tuku atu. Ko ia fitu taka ngaton pe ko ka silia taimi i he messenger, pe a lava ke ne o atu ai mahu inga, he fu matu aki. Whaka atu i au pito o whakatatau ki he taimi o ngahi ai pe a moe mea kone o whamoleki, he e ku lava pe a mawe au pito ke o atu ia ki he ngahi katoanga pe ko ngahi fie mau. Ko e mahalo ko e ki i whanongonongo wha o si pe te o atu heni. Ta e peki po fasi sela ba. Ko me I make the last announcement. Ta e maki fasi po tu bewa. Ai ke mea ke. Kata kino. Te ke tae mai peki i whaspoto patoke. Kolo iloa ia o e malata aia o ko amanaki ke whahoko ai ki apisia mo ki aptanga mamahi. Ko e whakahike eka o ki talavou tonga ko sione nai toko ko ne malolo i hono ta o tolongo fulmao no. Ko ki i fohaini o foto aika nai toko ai na iloa ko popo. Ko foto aika nai toko na malolo ia i he wawhe taha walu. Pea koe malolo e ai taha ahono foha, ai a ko sione nai toko. Pea koe no amanake whahoko ahono mea whaeiki, i he aho sa pate ko ia o i wikeni, e whai pe ai ki whawhamiri pe. mo ki a po pe ko fai lotu pe ke whanonga ke family pe au ata pe kia hataha kia hane ofa o lava le pe ke mo mea mai pe ko mo mea hake ki he api ko ia o pōwhele ko api au si whakahoko ai aptanga mamahi koe ni ai mole atu ai ki foha ka koe toko ua ka koe tamai ke ki whanau paia pea ko ia o atu pe ai whanongonongo koe ni ka o ki ai haka inga o mo si i manat ke iaha mo ofa ka whataha me ki talawo koe ni i he kolo e malata ko sone nai toko ko ne hiki whanua ki o tau api mao ko ne malolo e ni ono tau tolongo fulmao no pa o amna ke whahoko pe ai whai pe ai whawhamiri pe a moe whai lotu pe i he whiawhi sāpate i he api no whaanga pe ko ia o pōwhele ai nai whai ai whahoko mea whaeki ko ia o foto ai ka popo nai toko ki mo atu. Pea ko ia ai koe ahamoni te rewa e whai lewa aho no whakahike he ka. Ko ia aku i kai ke to e whai ha tala pōpoaki he ko i ngā ko full-time whai ngā taa eni. Ka koe whakaongona tu pēkia ki mautolo si ka i ngā ofa mo e ka i ngā kotoa pē o mo mea mai i he ope mo e ngalo ea. Ko e aptanga mamahi e whai pē ai whakaapa-apa mo e tatau whakaosi i he whiawhi sāpate. I he api no whaanga ko ia o pōwhere nei toko. Aia nei whakahoko ai mea whakaeki o popo nei toko i he wāwhi tahawalu. Pea i he ahamoni te e whakahoko lewa aho no whakahike he ka. Ko ia te tatau atu he, pea koe ki i whamiri hono kotoa, mo e ofa atu me he witou, me ia Losilini Tonga. Ko ia pe ai whanongonongo, pea mo i whia kau ngā mamahi atu ai polokalama, koe ni ai Voice of South Pacific, le o i Pacific South mo e ofa lai atu ki he whamiri, kai o mā Losilini, kai o mā pōwhere, mo ki i whanau paia, ofa atu kia ki mautolo hono kotoa. Malo au pito homo mea mai u tau kau whatahi polokalama o e aho ni, te utatau atu ai peheni, koe whirimo tōk whahoa a, ko Silvia whate mataim aho, koe whai pele lei taha, whamore more ala ka paunai i aha tō whatongia, nā kai ki tuha mo tāu mo ho whe mau. Pea mo... Neta? Neta tua?
Tāpea lava.
Tāpea lava, pea pehe whoki ke mau ensini a koe ai le teo, mai lava lelei ai toko ni ke ta whakahoko tau polokalama, ko selasi i te urilo mou mea.
Te ilangi mai